I'm going to take a few minutes just to kick off with some basic updates. And then we've got professionals from the health department and from our healthcare system that are joining this call that are available to answer questions. So you might ask, what's the difference between 2 weeks ago's call and this call? I think that now that we've got a back on track document and we've got a roadmap for your reopening, and some of you as retailers probably opened your doors Monday, we wanted to share more specific information that might be critical to you on making sure that your workplaces are set up, and we'll share some of the things we're doing to make sure that we continue to be as helpful as possible through this. But most important, this is your opportunity to ask questions that you may have run into with regard to how you prepare your workplace and help your employees and your customers to be safe in this new environment we're in. So I'm going to kick it off by asking if Dr. Hunke has joined this call yet. When she does, we'll connect. But I know we've got Ashley and Chris from the Vanderbilt County Health Department on the line, so I'm going to thank them for being with us today. They know far more than I could ever begin to know about what we need to be doing, and they'll be able to give you some good guidance here. But let me cover a couple things first. If you haven't seen Back on Track, it's the newly announced roadmap for the state of Indiana for opening and timing, and it came out last Friday. If you happen to be in Kentucky, the Healthy Workplace Plan is coming out in pieces as well, and I think that guidance is available to you on the state's website as well. They don't completely align, but they're pretty close. So just in general, I thought I'd mention both states here. A couple things that I want to speak to specifically. We're expecting, and we hope you'll bring your questions on customer safety, on how you manage social distancing. I've put an agenda up here, some other topics that are likely to come up. But a couple things I want to mention up front. By next Monday, Back on Track requires all businesses to have a reopening plan in place. It's not very extensive. It requires you to speak to a few things. They'll be on our website, the details, but basically it's how you're going to manage employee screening, what your cleaning protocols look like, what your plans are to help your customers to be in your space and have access to cleaning materials, and what you're doing to manage social distancing. So all the things you would generally guess. And there's some other recommended criteria as well. So that information will be on our website. It'll be on the City of Evansville's ReOpening Evansville website. And we're working on developing some basic tools to help you with that content. And you'll see that
good.
We've got some folks that are joining us from Deaconess. I think Dr. Hunke is on the call, and Don Rogers will be with us as well as Kim and Tammy. So we've got a good team of healthcare professionals as questions come up. We have muted you. So you might wonder why we did that. Just cuts out background noise, but please feel welcome to unmute as you need to. And other than that, I want to kick this off by asking if some of our healthcare professionals that are on the line would like to take just a minute and tell us the top 2 or 3 things we should be thinking about as we get our retail businesses open. I'm going to try to call on Dr. Hunke, but if she doesn't pick up this call and Kim or Tammy from Ascension are available, who's out there?
Good morning. Good morning, Tara. This is Dr. Hunke. Can you hear me now?
Yeah, I can hear you now. I just have to know your phone now so I can pick you up. Thanks for being with us.
Wonderful. Thanks for having me today. Really appreciate that. Excited to get Evansville back on track, that's for certain. So I'll introduce myself. I'm Dr. Gina Hunke. I am Director of Medical Affairs and Co-Chief Quality Officer for Deaconess Hospital. And we're just very lucky and fortunate to have this opportunity to interface with the business community and make certain that we are prepared to reopen Evansville. Most certainly we have this document that we put together called Frequently Asked Questions, and so we think that those are the top things that you would be interested in knowing and asking about. I'm assuming that that has been widely distributed and everyone's had the opportunity to take a look at that.
It is on our website, but one of the things we'll do is we'll send that out to everyone on this call afterwards, because we will distribute these slides and any pertinent material that you all come up with. So we'll send that back out to folks on this call, just to save you the effort of going to either our website or the city. So yeah, we've got that out there. It's a great document. Thank you.
Oh, that's fantastic. So I think everyone's questions will mainly focus around how to provide a safe environment as our customers come back into our retail businesses, and how to obviously protect our employees and provide and promote social distancing. We also tried to put together this guideline, but I'm certain that we probably left out some questions that you're curious about. So perhaps I ought to just let you take it away and see what we come up with.
Well, that's a great suggestion. Thank you. May I just kick this off by asking those of you that are retailers that are on this call and have opened, any of you got a first insight to share? You know, my habit is to start calling on you, so.
We might also ask the other healthcare experts on the line to introduce themselves, if that's possible.
Yeah. I think Kim and Tammy are on here from Essentia. Kim Balesa, are you with us?
Yes, good morning. This is Kim from St. Vincent Evansville Infection Prevention, and Tammy Work is on the call as well.
Great. And Don, are you with us from Deaconess? Well, I've already pinged on Chris and Ashley, but Ashley, would you take just a moment and introduce your team? You got to unmute. You need to unmute yourself.
Okay, sorry about that.
You got it. You got it. No problem.
Hi, my name is Ashley Libert, and I'm the supervisor of clinical nursing here at the Vanderburgh County Health Department. So my team is just in charge of the case investigations and contact tracing for all of the confirmed cases here in Vanderburgh County. You know, so we're just kind of part of that process of identifying where people were exposed, and how we can mitigate that exposure and further spread within the community, and then also in charge of contacting those close contacts identified and providing education on the quarantine process and the timeline and when they can come out.
So if one of our retailers learns that someone's been in their space that has been found to be positive, you know, they've probably been in to do something and left, you know, what's their responsibility? Can you speak to that just a bit?
The responsibility for the retailer
Yeah.
is definitely making sure that their employees are practicing all of the things that we've just kind of repeatedly said. So making sure they're wearing a mask, they're practicing hand hygiene, they're social distancing to lower that risk of exposure when they're in that retail facility.
So let me ask the hard question that someone probably wants to ask. They don't have to close, do they?
I wouldn't say right now that they would have to close having just one known exposure within their facility. However, if those numbers continue to increase and the practices they're putting in place for infection control aren't working, then you're going to have to look at other methods to slow that spread.
Just thought I'd ask that hard question because I know that it's incumbent upon all of us, and I'm just going to speak for everyone on this call, to do everything we can to recognize that the virus is still out there, and we're going to operate in an environment that protects us from it. Which of you wants to talk to us about the mask issue? Because I am guessing, and I'm seeing a quick note that the awkward thing for our retailers is going to be to guide customers to wearing masks. And I think that's going to be very important to getting our customers to feel safe in our environments. Can anyone comment on how that's gone so far if you're a retailer, or I'll ask our health professionals if they offer us some tips on that.
This is Dr. Hunke. So we are definitely requiring universal masking at our healthcare facilities, and we're asking employees to take a mask home with them at night or use a cloth mask upon entry and then change into a procedure mask when they go into the patient care areas. So we're definitely promoting social distancing and making certain that everyone is masked appropriately. We have found a few challenges around that. There, of course, are times when you have to take the mask off in order to be able to eat or drink, meal breaks, etc. So we're trying to social distance during those times. I think that's our main challenge, basically, and everyone just having access to a mask.
Of course. I will take a second on that because on the Chamber website is a list of local suppliers. So if you're having trouble getting supplies, check that. We try to make sure that, you know, lots of places you can order supplies and they may not be available. So we've given you lots of options. Also, as of this morning, the state of Indiana has opened their PPE marketplace. So if you go to Back on Track, Indiana, you'll find that there's a link there. I encourage you to look locally first because the state's going to be trying to deal with the entire state, and we think we've got a decent supply here of most things, gowns probably accepted. So we've been talking to our close contact and salon folks, and they're having trouble getting gowns, I know, but there is a more available supply of masks and sanitizer than there was a few weeks ago. I've got a question out here that I see has been asked to everyone, but if anyone has a specific guidance from our healthcare pros on the shipping and receiving. So the virus on packaging, I think, might be the way to think about that question. Is there any advice on how we might approach those sorts of things other than keeping our hands constantly clean?
Well, this is Chris with the Vanderbilt County Health Department. I'm the director for the environmental division, so we specialize with the food industry and all. But, you know, FDA, they speak to those type of things, and CDC does too, and just saying, if you do have, you know, some of your wipes, disinfectant wipes or something, if you want to wipe, if it's a plastic, if you want to do that first, you can do that. And really the key, I know people get tired of hearing it, but really the key is to wash your hands before you have any hand-mouth contact or touch your face or your eyes, because that's going to be one of the main modes of transmission. So yes, if you get packaging, you can clean that, but even if you take the packaging off and you discard that, if you wash your hands and then maybe even sanitize maybe the area around that, that should do that for you. Protect.
Thank you, sir. I know that I've read as much guidance as I can get to, and I'm not seeing a lot of guidance on how customers and employees in retail spaces can manage the need to touch things, try things on, that sort of thing. Has our public health folks given thought to that, or have they found guidance on that we just haven't connected with?
No, I don't think, other than what we just said, I think those would be the key things that you can do. So I don't know, again, if it's a retailer and you're trying on clothing or something like that, I mean, again, it's just important to make sure when you get home, you can, you know, wash up, avoid that hand-mouth contact, have hand sanitizer maybe even in your vehicle, those type of things. Really, that's going to be one of the main things you can do. And even if you have a added concern, you know, with something that you can launder, go ahead and wash that.
So how about our retailers that are on this call? Have you do you have advice you can share with others on that? I know some of you were on our call a couple weeks ago, and we talked about how we're going to manage the customer wanting to be in the shop and, you know, checking out merchandise. Anybody got content on that would be helpful to your peers? Well, I guess we'll hear as we go on that one then. May I ask if our participants have found the supplies they need available locally? Are there gaps that we haven't identified? It's my habit to slap an agenda up, and so I put one in front of you on the screen here. That's my guess, and I'm always careful to say, you know far better than I, but these are the things that I'm guessing are the issues right now. Are you laying out your stores for safe social distancing? Is that working out pretty well?
Hey, it's Heather from River City.
I was going to call on you soon if you didn't pick up, Heather.
Yeah, we've ordered hand sanitizer, but they're not sure if it's going to be here, our dispensers and everything, before we open. So that's kind of a worry. I ordered on the PPE marketplace through the state this morning for our shop. in hopes to get something that way. Masks, again, we've been able to like find them online and things like that, but just not in time for us opening this weekend. So,
Yeah.
so I guess that's been kind of, people are going to have it, but they don't even really know when it's coming in. So,
Yeah. So will you use handmade or sewn masks until then, or what?
yeah, that's, I mean, we're only able to bring back a couple employees at this point. So, so we'll just have those handmade masks, and then I will spend the next day or two really seeking out. We have a half a bottle of hand sanitizer left here before. So that should hopefully get us through a day or so. But I'm hoping that we had ordered the dispensers through Centos, but they just aren't really sure when they're going to have them in.
Well, I know there's a good local supply of disinfecting. It's liquid though. It's not in the gel form. But I know that that's a pretty good supply of that locally. We've got that connection on our website if that's helpful. But it's messy. So
yeah.
Yeah.
And I think our problem is so much the dispensing of it, not like you can find it, but to have something when people first walk in the door, we kind of like a stand and different things like that. So yeah,
I think it's like a good idea.
Than the actual obtaining of, because we can find jars of it or whatever, but that doesn't really help us from a customer point of view.
Right. No, I understand. Well, we're wishing you great luck on your opening.
Thank you.
Yeah.
Hi, Tara.
Is anybody in this call that has got any contacts they can share? I'm looking at, oh, Greg Miller, I see your comment there. Thank you. That's helpful, Greg. Thank you for posting that. So Greg, is your business open?
Hi, Terry. Yeah, we opened Monday, and with being a small volume with our birdseed backyard bird store, we've not had very many difficulties so far in following the guidelines and rules. But the hand sanitizer was a thing that we were trying to figure out. So we got our own spray bottles, like duplicated the label that they put on the bottles out at the distillery, and we put those on our spray bottles. It is the thin stuff, so it kind of is a little messy, but we have a towel out on a table, and we're keeping it off the floor, and just asking people as they walk in, there's hand sanitizer there and at the cash register. So we're talking to people as they come in. We're able to do that being low volume about using the hand sanitizer and not touching everything. If they want to see something, we'll get it for them.
That seems like good guidance when you can, is to have the employees do the touching as much as possible. And in your business, that will work.
Yeah, it will. And the only one more thing about the Dusty Barn Distilleries, they're only open 3 days a week with limited hours. So, it's a family-owned little business out towards Mount Vernon, just past USI. So if you need to get hand sanitizer from somebody like them, it's limited on when you can go.
Yeah, I actually drove by them on the weekend. I was thinking about them, so I appreciate the specifics.
Tara?
Yeah.
This is Karen Lamond. I have Angela Interiors and Entwine.
Yeah,
We're not open yet, either one of us. We're going to open next week, but I do have a resource for the sanitizer by the gallon. It's called sugarcreeksanitizer.com.
Okay.
And I can type that on there in a minute.
Okay. Yeah,
but
great.
They sell by the gallon, or they sell by the little bitty small bottles, but they ship within 24 to 48 hours. And I think it's like $69.99 a gallon, but it's expensive. I've also ordered the stands for both places, but cannot find the dispensers. Have not been able to locate those. And
if you're mechanically inclined, we've posted a schematic to build a foot operated dispenser on our website.
Oh, really?
Toyota's using them all through their place. They're pretty cool. You use your foot to kind of pump the dispenser, and so it's an option if you've got somebody that wants to do a little construction project.
I mean, I can't even find a decent sized bottle to put on a table.
Yeah.
Cover the little bitty bottles. But we have an employee at Angela who is out of our leftover fabrics, is making masks for our employees and the customers as they walk in the door.
That's wonderful.
And we are, social distancing in the store. We have our places marked around the checkout counter, and might even put up a shield if we can figure out how to make one. But anyway, just wanted to throw those out there.
Well, I appreciate that. Are any of you going to sell masks? You know, handmade ones?
We are not.
Okay, just curious. Well,
Hi.
This is
Can-
Heather from River City. Oh, sorry. I know one of our makers was already making them while we were out of business. So when they're coming back this weekend, she's going to be selling those out of her area in our shop.
seems like they're going to be popular. Gregory.
Hi, yeah, Gregory Myers. My wife and I own and operate the Bead Angel, which is a small niche retail store
Oh, yeah.
off of North Weinbach.
Mm-hmm.
And we have no other paid employees. There's only us. And the two of us are both part of what's considered to be the at-risk population. We're both over 65. So
Yeah.
we're not open yet. We're planning to be open next week.
Mm-hmm.
We have, our plans are to have a disinfectant table as you walk in. And we've located pump dispensers for the disinfectant. We're going to have masks there. We've teamed up with a couple of local people who make masks, so we'll have those for sale. And at the current time, we do have a supply of the disposables, which will be available for a donation.
Oh, that's good.
Yeah. We'll just have a donation bowl there. And we're also going to use the nitrile vinyl gloves. We're going to insist that people both wear masks and gloves the entire time they're shopping. Much of what we sell is very tactile. People want to be able to paw through it, so to speak.
Yeah.
And the thin gloves are they offer both protection but also a good tactile sense. So we're just going to insist that that's part of the shopping experience to protect us and to protect them. So everybody wears a mask all the time. My wife and I will also have the face shields that we can wear when we're not intimately close to someone or when no one else is in the store. But,
yeah.
And then we can add the mask underneath that if we need to. There are our sales floor, our display floor, some places are a little crowded. It's a little cramped. We've done pretty much the best we can without actually eliminating whole sections of inventory. So
right.
we're just gonna experiment and see how it works. But we're reasonably confident that our customers will comply with our request to both mask and glove during shopping, and we'll make it possible for them to disinfect themselves as much as they feel they need to in order to feel safe.
Well, I'll get on my soapbox for a second and say, as we that are the merchants in our region show leadership in this space, it'll make it easier for our customers. You know, it's going to be awkward. Normal. So I appreciate your leadership on that, Gregory.
Thank you.
Jessica, were you trying to offer a comment?
I do have a question, and it may be silly, but how do I protect my employees and my guests from people that are asymptomatic? So they don't even know they've got corona and they could pass it. Is that really a thing? Or I keep hearing about people that are asymptomatic and have no symptoms, but how do we, are they still passing the virus?
I'm pretty sure our health department pros or Deaconess want to take that question.
This is Dr. Hunke. So the best way to prevent transmission is universal masking, everyone in a mask, and great hand hygiene. We don't always recommend usage of gloves because when persons wear gloves, they don't perform good hand hygiene. So they're still passing objects from object to object, they're still passing infection. So we usually ask that you don't wear gloves in that situation, but use good hand hygiene before and after touching objects and before and after touching your face or your mask.
So hand sanitizer is the king, huh? In our retail
sanitizer, yes.
Yeah. Among the other things I might mention, two things. This is giving you a chance to think of your questions, folks. That's why I'm doing this. First of all, everything that's on the Swin Chamber site is available to anybody. This is not a member issue. It's all out there for anyone in the business community to use. So many of you on this call that I haven't really met before, but I want to make sure that's abundantly clear. And second, there's also a lot of guidance on there on things to think about. If you have restrooms with quite a few stalls there, you might consider marking them off so only every other one is in use, or the same with a multitude of sinks. For most of our local retailers, that's probably not as big a deal because you probably don't have an 8-stall restroom. But I want to mention those things because those are other ways that you can make your customers feel comfortable and confident that you're doing all you can. Who else is open and wants to share their experience or is about to open this weekend for Mother's Day? Then I'm going to turn to our health department folks and say, if you're talking to our retailers here, what else should we be sure that we're paying attention to as a sector in our economy? Because everyone wants to be back into stores, you know, doing our thing, and we'd love your counsel on that. So
sure. So one of the big things that comes to mind is enforcing that social distancing. We want to keep 6 feet from other people. So even if they're standing in line, making sure that, you know, there's markers on the floor so everybody is standing that 6 feet apart. I know in retail stores it's hard to make sure that everybody is staying 6 feet apart because you're constantly moving and you know, looking at different things. But if employees can be aware of who's around them, and as they're watching the customer shop, kind of just making sure they're keeping that distance. Also, something that we've also had to think about here at the health department is those employees who are rotating to different stations. We need to make sure that they're kind of just assigned to one workspace so that if they are sick, they're not contaminating different workspaces that other people would be going into. So just assigning one individual workspace.
So how about locker rooms and things like that? Should we be discouraging people from putting their stuff together when they come to work? Is there advice out there on those kinds of things?
I don't think that there should be a problem with the locker rooms if they're just, you know, once again, you're limiting how many people are in that space. Everybody's able to keep their social distancing. If they're just going in to put their stuff away, and just making sure that after they touch surfaces, door handles, you know, their lockers, anything that they frequent high touch surfaces, that they're using hand sanitizer and washing their hands after.
That's great advice, because I'm watching the chat, and you know, the real toilet paper issue is wipes. And if anyone's found a source of wipes, we all love to know, because I think that is the limiter that would be so helpful as we're getting reopened. And I'm hoping it's coming soon, but we haven't really problem solved the access to wipes yet. But I think what we'll do is count on using the disinfectant until then. I see that we're posting specific retail guidance has now been posted at the state website, Back on Track Indiana. So we'll get to that, pull whatever is there, and make sure that it gets transferred to our local site as well. Just catching with that. Thank you, Mr. Schaefer, for posting that. What other questions out there should we be thinking about? I'm pointing this toward the retailers, but as soon as you have had a chance, I'm going to ask our health professionals to share a little more with us. I do want to turn it back to the health professionals while you're thinking of your questions, because the governor's plan was clear that this is all dependent on us keeping a ready availability of support in our healthcare system, so that as there are continued positive cases, we're prepared to handle that. Are there things we should know as kind of leaders in this community to make sure that we're being supportive of this reopening going smoothly? Would our deaconess folks like to comment on that?
Well, this is Dr. Hunke. So I would just say that you're doing all the right things by encouraging universal masking, great hand hygiene, anything that you can obviously avoid touching, and cleaning those high touch surfaces as frequently as possible. You might also want to consider non-cash transactions as a way to limit the spread as well, and encouraging social distancing at your registers, etc. Is anyone invested in the plexiglass shields to help provide some distance between customer and employee? I think you've probably all seen those when you've been out at Schnucks or Target, etc.
I was in a couple of local downtown businesses earlier this week, and they put them in place. So I think that quite a few businesses are considering that. Are those of you on the call finding that you can either make those or get access? They're pretty easy to make, actually.
Yeah, we got some made from Sinorama.
Okay. I was going to say, I know Sinorama is there to help, and they're being great partners in this, and I think others in the business are too.
Slade print down the street from them is making them as well. So they're even able to customize like our handout area to accommodate our cups to be a little bit taller so that we don't have to reach around that. So that was really nice.
It's slick. Are others running into good advice you want to share on how you're managing social distancing in your places? Well, I think we've all been in the large grocery stores where we've seen the one-way pass down the aisles and that sort of thing. I don't know in the local retail space if that works or not, or if it's necessary or not, but I imagine you'll all check in and share that information as we go. Chandra has just put the industry guidelines out for all of you on our local website, so just to keep you current. What else should we be thinking about, friends at the health department? I know you're in the business of tracking. There have been so many news reports about tracking being the real issue, and I'm not arguing with that, but it seems like making sure that we survey our employees beforehand seems like a more important tactic for all of us to pay attention to right now.
Right, so that is, I'm very much in agreement with screening employees at the beginning of their shift. For fever, cough, shortness of breath, they recently added some more symptoms to that list.
Where's the list, Ashley?
Throat, I'm sorry?
Where can we get that list?
The CDC has a great list. If you just go onto Google, search COVID-19 symptoms, and you can find them there. Some of them are GI symptoms. So anybody who's having symptoms or identified at that beginning of the day screening needs to be sent home. So I'm very much for the employee screening the start of every shift. And then also look at where your employees would possibly gather. So if you could stagger lunches and breaks, because if they're not able to social distance during that time, we don't want them gathering. So if you could stagger those lunches and breaks, we find that to be very helpful. And then also encouraging your employees that even after hours, we still have to practice social distancing, even when we're not at work.
Thank you very much. So you'll see the agenda up on the screen. I'm going to just raise the issue once more. Are there other issues you're running into? I've mentioned childcare. We've been paying attention to that a lot. Other, regulatory issues, if there are, and you want to share them, please do. If you don't want to share them, get in touch with us, and we'll still be happy to help you out one-on-one if possible. I'm going to reference two things. First of all, Chandra, can you go to the next slide? So tomorrow we'll have a door cling available for you, and we'll put out a package digitally that you can print off if you have the capability, that's got content you can use for Instagram, whatever your social media is. I'm encouraging you big time to use social media, because the best way your customers will have confidence in coming into your store is to hear from you. We will do all we can to promote the good work you're doing to make your workplaces safe and welcoming. But I think everything you can do to tell your own story is a home run right now. So we're going to provide you some tools for that. If you want to print these, put them on your doors and use them as you wish. If you want an actual door cling, we're having some printed, and we'll make them available starting tomorrow, late tomorrow, I think, so that you can put these in your doors and basically let your customers know that you've done all you can to share the word. The other thing I want to mention, not to be predicting the future, But over the next few weeks, as your businesses start to reopen and you get a read of how things are going, if you need or want to meet with any of our small business professionals and look at your business plan, look at adjustments you may need to make, we want every business that's in our market to have every chance to come back out of this as quickly and successfully as possible. So if you're not getting the same flow of revenue you expected and you want to look at how you tweak your business plan, let us know. We'll hook you up confidentially with our counselors to help you look at those things, because it's going to be an interesting time for all of us. So I want to make sure you know that service is available to you. And the last thing I'm going to mention in my sales pitch, then I'm giving the floor back to all of you, is that some of the people I've talked with on these calls have been interested in staying in touch with each other. And so we've formed a couple peer groups. Some of you are in them already, so that you can help each other through these next few months as you see how things go. So if you have an interest in that sort of thing, we won't just hand out everyone's contact information to each other without your blessing. But if you're interested in that, send it to me privately in the chat, email me afterwards. I'm at tbarneyswinchamber.com. Let us know about that, because we're happy to do all we can to help you, enable you to make these transitions as successful as possible. So that's my sales pitch. I'm going to ask our health professionals what else they want to share with us, and I'm going to ask all of you if you have other questions we haven't gotten to. And while I'm doing that, I'm putting a couple resources up here for your convenience. Anything else from our health professionals that you were hoping retailers would ask you this morning and you wanted to be prepared to share? And if there's not, that's okay, but.
Good morning. This is Kim from St. Vincent, Evansville.
Hi, Kim.
Good morning. One thing I would like to suggest to the retailers is, besides doing the beginning of shift screening, also make sure your employees understand if at any time during their work shift they start to feel ill, develop a cough, sore throat, become feverish, to please report that to their manager on site so that can be addressed right away. And also encourage each other to support the hand hygiene. I mean, doing this much hand hygiene throughout the day has probably not been the norm for people working outside of healthcare. And if we see someone going from a high-touch surface to another task and they did not perform hand hygiene, just give a friendly reminder to your coworker that, say, hey, would you like a squirt of hand hygiene? Just something non-punitive to keep everybody safe and get everybody building that muscle memory on how we're going through these extra safety measures.
Boy, that's great advice, because I think the hardest thing for all of us, but our best opportunity, is to model and support our employees making these changes, because it is going to be tough. I'm carrying hand sanitizer with me all the time, but I have to admit, I'm one of those people that said, bring on the germs. So this has been a new normal for me, but I'm doing my best to make sure that I am walking out of here with a mask on my face and that sort of thing. So appreciate those thoughts and comments. Go ahead, please. Kathy?
Hey, good morning. How are you all?
Good.
Good. Hey, I just wanted to take a few minutes and let you know a few things that we have done in Spencer County with some of our retail businesses prior to doors opening. Well, I take it back. One, we did prior to doors opening, we did a virtual walkthrough. We've been doing virtual walkthroughs. So where I've gone to the business that either folks haven't been able to or aren't comfortable to go in. And we've done store walkthroughs and comments, come through on the Facebook Live, that kind of thing. We did that with Santa's Toys a couple weeks ago when the doors were still shut and just curbside pickup. And then just recently, Monday night, after a lot of anticipation of local retails being able to open, we did a walkthrough of Evergreen Boutique in Santa Claus. And I mean, we were getting hits after hits of people purchasing, from our online presentation. Hey, do you have this in this size? Hey, how much is that hat? Hey, how much is that, whatever. And we had a nice little basket of sales just with our virtual walkthrough. So that eliminated customer contact. Well, I shouldn't say eliminate, but it's curbside pickup. They're going to have it ready. So maybe for those folks that aren't so comfortable to come into the store yet, or maybe just from the retailer side that you want to help that 50%, limit that 50% in with virtual tours through your stores. And then customers can be like, oh my God, I love that. I want to go ahead and buy that. Have it ready for me. I can just pick it up.
That's a great idea. Now that is using social media brilliantly. I'm available to do walkthroughs, by the way.
Hey.
If there's coffee involved, I'm really available to do a walkthrough.
After 5, maybe a glass of wine.
Or wine.
Tara.
Sorry. Yes.
Tara, this is Sharon Lamond again. I have 2 questions. Are masks required for customers?
I'm going to let the health department answer that because I'm sure they're going to say highly recommended, but
Yeah, I understand that's highly recommended and all that, and we're going to do that, but can we,
can you throw them out?
Is it a law? Is it a legal thing, where if they refuse to wear a mask, are we okay with telling them they can't come in?
It's my understanding, but I'm going to let the health department follow me up and correct me, that it is not a law, but you as the proprietor can ask them to leave if you're uncomfortable. So I believe you've got that discretion because it's your place to keep safe. But I don't think it is. I don't think you can say it's the law. You've got to put one on. Okay. Anybody want to trump me on that legal advice I shouldn't be giving?
I think you're right. It is a guidance for the others. And obviously we know that if you do social distance and you use both people wear a mask, then that's even greater in preventing the spread. So in the restaurants, I know it is required that all staff has to wear a mask, face covering. But then as far as the customers coming in, it's a recommendation. So, hopefully, try to encourage it as much as possible, when you're going out, but to say that you have to wear it, but it is your store. So I think you have that right to say these are requirements to enter the store. And I think legally you can do that. So,
okay.
Especially if you're not comfortable.
Okay. One more question. Liability with the contact tracing. If it happens to get, somebody in the store happens to have it or get it or whatever, can they, and it's traced to our store, can there be legal issues with, okay, you got it from somebody in this store or an object in this store? Is there any legal, can they come back on you, I guess, is what we're interested in.
I don't know the definite answer to that, but I don't know if they could actually 100% trace it back to a store because there is community spread, so you can, pick it up anywhere. So I wish I could provide you with a better answer on liability for that, but I don't feel that there would be any ground to stand on.
Okay. All
and
right.
I think as a retailer, if you're doing all the things that, that you can do. So if you're wearing a mask, if you have sanitizer, you have a sign posted that say, hey, these are our processes and how we clean and sanitize, we social distance. And also, by the way, if you're a customer and if you have any of these symptoms, please do not enter at this time, So I think if you have those things in place, that, that shows also that you're doing all those things in good faith as well. So
right.
It's got to be helpful that way.
Right. Okay. Thank you.
And I think that, it's fair to say that anyone can sue anybody, and there will probably be a lot of liability stuff coming out of this, but I'm hopeful that in our community, goodwill is going to reign. And I think that one of the reasons we want you to consider using social media and being proactive about what you're doing and making wearing masks a pride moment is to lessen that inevitable environment that's going to come up. I saw Jesse Kaufman post a really nice observation about how staff could give, thumbs up to customers that are wearing masks and that sort of thing, just to build that kind of energy. So I think that's the intangible opportunity for us. And, you know, I think that there's a lot of phenomenal retailers in this market that are going to do everything. They've always done everything you can to make your customers feel safe. And I think this is going to be the next big test. Our time is, your time is valuable, so I won't keep our call going any longer than you have questions for, but I sure appreciate you making time for this dialogue. I appreciate those of you that have shared what you're doing. Those of you that run into issues, we are happy to stand up either another town hall or, as I said, a peer networking group, any of those things that help you to make sure that you've got access to the tools you need. And if something isn't coming your way that you think we need to know, please shoot me an email. You know, we are an open book right now and wanting to make sure that we're providing you with all the opportunities we can to get back into the retail business that you've built in this community, because we miss what you're doing as much as you miss doing it. So without further ado, I'm going to reinforce two things. If you're interested in using the welcome back material, it should be available tomorrow. And if you need more assistance in any way that's not on our website or on the Reopen Evansville website, please just let us know. But thanks a million for being with us today. I think there's one last message I'm going to make sure that I catch. Okay. And to our health professionals, thank you for your time. We appreciate, we know you got a million things to do, but thanks for being with us.
Can I ask one more question?
Hey, yeah, I knew I'd drag it out of you at the last minute, Gregory.
From the health professionals.
Yeah.
One of the things that I'm seeing advertised online are these handheld UV light units for disinfecting. So I know UV light is a good disinfectant, but are these handheld units worth anything? Are they worth trying to buy one and use it? Are they effective at all?
That's aimed at our health professionals, so I'm going to hope one of you wants to offer observation on that.
For example, for disinfecting cash or small items that are brought to the counter, that sort of thing.
Any of our health pros still available to take that one?
Yes, this is Dr. Hunke. I think we would have to investigate that specific unit. We do have specific requirements around the wavelength of the UV light that is required to provide disinfectant, and also the time and distance that it's used. So I'm not certain about the online UV lights that are for sale commercially. We could actually give you the specs for our requirements for disinfectant, and you could compare those to the online units if you like.
Okay. All right, thanks.
Mm-hmm.
All right, well, it's nothing like saying we're going to sign off to get people's last minute questions, but thank you all for being with us, and all of you that had questions, thanks for sharing them. I know that your peers and colleagues that were listening had the same questions, so we appreciate your participation, and we're wishing you all the best of luck, and I hope there's lots of great sales going on in the next few days and weeks as you get reopened. Thanks for being with us.